Hello, my name is Ellen Van Lent. Welcome to our Getting Norfolk Active training. Over the next 30 minutes or so, we'll be giving you an introduction to physical activity and local opportunities available to you. To start us off, I'd like to hand over and introduce my comment. Amy Story.
Hello. So as Ellen said, this is training on getting Norfolk active. So who are we? Active Norfolk is the strategically for sport and physical activity in Norfolk. We're one of 43 county sports partnerships across the country, and we're hosted by Norfolk County Council. What is physical activity? Physical activity is defined as any bodily movement produced by skeletal muscles that requires energy expenditure. Physical activity includes all activities at any intensity which are performed during the day or night, and it includes activities and exercise which are integrated into daily activity, such as walking to the shops, cleaning, gardening, etc. Physical activity can be broken down into different categories. Active living, which includes moving around your house, daily tasks, cleaning, gardening, just general activities. Active travel is walking or cycling instead of taking the car. And active recreation can include dog walking, going for a bike ride, something in your leisure time. And then active sport can be broken down into formal or organised sport. The importance of physical activity. Physical activity can reduce mortality and mobilities. So it has been proven to reduce the risk of developing certain long-term health conditions. So depression can be reduced by 48%, the chance of getting type 2 diabetes by 35%, coronary heart disease by 25%, and brain fractures in older people by up to 66%. We've also got a wider wellbeing benefits of physical activity. So the individual development, which can include improved confidence, self-esteem, but also the development of soft skills such as leadership and communication. Physical activity contributes to 1 in 6 deaths in the UK, up to 40% of many long-term health conditions. But in addition to developing long-term health conditions, physical activity can also help manage the condition. And around 30% of later life function limitations and falls. And the estimated annual cost to the UK is £7.4 billion. Physical activity levels. Potentially around 3.5 disabled people are at greater risk of poor health and utility. 4 in 5 disabled people report that they would like to do more physical activity. However, 42% of disabled people are classed as inactive compared to 21% of non-disabled people. But the activity levels also vary between social economical groups. So disabled people from lower social economical groups are more likely to be physically inactive compared to disabled people from higher social economical groups. So it's 43% versus 29%. Almost 2/3 of disabled people said they rely on benefits to be active and pay for activities. Almost half are fearful of losing their benefits if they are seen to be more active. And more than half of the people questioned in the survey said they were likely to be more active if benefits weren't at risk of being taken away. In regards to getting more active, 2 out of 3 people said they would listen to a GP, of their doctors or nurses about taking part in physical activity. 3 in 5 people said they would listen to physiotherapists, occupational therapists and other medical professions if they were given advice about becoming more active and advised to increase their activity levels. How much physical activity should we do? So the guidelines say each week physical activity should add up to at least 150 minutes of moderate intensity activity or 75 minutes of vigorous or a combination of both. But you can also do very vigorous intensity activities as well, like HIIT sessions, and it all counts. Adults should aim to be active every day. Any activity is better than none. The more activities, the better. But in addition to being active, it's also about minimising the amount of time being spent sedentary, so e.g. sat on the sofa watching telly or lying down. If you need to sit down, e.g. like in the office, the guidelines recommend you break up periods of inactivity with like this activity. So this, for example, could just be getting up, walking on the spot, or just walking around your house or the office. An easy way to kind of remember different intensity levels is if you're doing light intensity, you'll be able to sing when doing the activity. Moderate intensity is you can't sing, but you can still carry out a conversation. And if you're doing vigorous intensity activity, you'll be breathing so hard you won't be able to speak. In addition to the physical activity they recommend you do each week, it's also recommended to do strength building exercises to strengthen muscles and bones. This can involve using body weights or working against resistance. So you don't have to go to the gym and lift weights for your strength building exercises. You can do simple things like press ups at home, yoga, but also things like carrying shopping bags will count towards your recommended levels. So anything with a bit of resistance. Gains are from those people who go from doing nothing to doing something. So if everyone who currently does 0 physical activity per a week, by getting them to do something, they will all gain some health benefits from doing it. Physical activity and motivational interviewing. When talking to service users, every conversation you have, you should try and involve physical activity, because every conversation you have with people about physical activity is important in supporting behaviour change over a life course. As you can see from this graph, some research has shown doctors needed to talk to between 50 people and 120 people to advise one patient to give up smoking, where to get people to be active, a doctor only needs to advise 12 people. So 1 out of every 12 people a doctor will talk to will increase their physical activity. But both have comparable health benefits. So every contact, let every contact account in regards to physical activity. Even if you don't think it's going to make a difference, it's worth just asking the question, what physical activity have you done in the last week? Counting for 1 in 5 of our population, disabled people, including those with long-term health conditions, are a significant audience to engage with in regards to physical activity. When it comes to talking about physical activity, it's quite handy to use motivational interviewing principles. So resist the urge to dictate the conversation, understand the individual's reasons to change, listen. The solution lies within the individual. If you tell them what they need to do, it's unlikely to bring any change about their behaviour. And also empower the individual that they have the ability to change. And also use the 3 A's of brief advice. So identifying activity levels. So you can ask how much physical activity they've done in the last week, how many days they've done it on, and does this average 150 minutes? Assess, so discover the patient's ideas and perspectives. So what is their understanding of how physical activity can benefit them? Ask, are they interested in becoming more active? Obviously, if they say no, next time you have an appointment, you can ask the question again and bring up the topic. Um, and also assess how confident they feel about increasing their physical activity levels. And if people do want to increase their physical activity levels, you can then advise. So ask them what goals they would like to set, and how will they monitor the progress. And it's worthwhile kind of starting small and building up. It's easier to kind of change behaviour that way. Risk management of promoting physical activity. So there's a few points to consider before people start increasing their activity levels or their intensity. So one, their current activity levels, certain symptoms of certain diseases people just need to be careful of, and their planned exercise intensity. Most people can exercise without visiting a doctor first, and exercise is great for most people. But again, there is a slightly higher risk of those with cardiac problems or diseases that they just might need to speak to their healthcare professional first. The majority of the time, everyone will get the go ahead, and the risk is greater health benefits and the risk of kind of developing the health condition further. So local opportunities. So some of these projects are on hold at the moment during COVID-19, but as restrictions start to lift, they will hopefully start up soon. We've got Broadly Active, which is the exercise on prescription scheme. These sessions are currently available in North Norfolk, Broadland, Norwich and South Norfolk, in this 12-week exercise programme. You need a referral from a healthcare professional, so a nurse, doctor, or a specialist of the hospital. So they fill out a referral form, and then Broadly Active will contact the service user or patient to discuss kind of baseline measurements and the programme. Lots of community-based classes are starting back up to the moment when most individual school halls legislature can pay as you go. Different classes with different levels. It's finding what people kind of enjoy. All to play for is a football session for males who want to improve their mental health. There's health walks dotted around all of the county. These are led short walks, and they're aimed at people who want to increase their physical activity and normally vary between 1 and 3 miles. So if people want to walk slightly further, you also have the ramblers, which are running in the county as well. And then you also have On the Move, where an instructor goes into different daycare centres to encourage physical activity in the centre, which is kind of ongoing. If people don't want to go to a community class or exercise on referral, or aren't able to access the sessions because there are none in their local area, there are a number of other opportunities available. Most smartphones nowadays can track physical activity, or you can download an app. There's I Prescribe Exercise app, which is an online exercise on referral program, which is ideal for anyone who can't access Broadly Active. So users type in some basic details, and then a personalised program is sent to their phone, and which they follow for 12 weeks. The NHS website's got lots of gym-free worksheets, so exercises which can be done in someone's own home, and they're aimed at all levels. Loads of online sessions available, especially on YouTube, online yoga for something a bit more intense. You've got some high intensity sessions, HIIT sessions. Joe Wicks does sessions aimed at kind of younger people all the way through to old people. And if someone wants to start running, Couch 5K is ideal. It's kind of a walk-run program which builds distance and time over the course of 10 to 12 weeks. And if someone wants to repeat 1 week, that's absolutely fine. They can just do as many weeks as they want. As mentioned, the NHS has got some worksheets which people can follow, but they also got some videos which people can kind of do in their own time. So there's a aerobics video, a strength video, and some Pilates and yoga sessions. But they also do some 10-minute workouts as well, which are ideal for people if they're short on time. To find out what community classes are available in the local area, Class Finder is an ideal website for this. People can search by postcode, type of exercises they want to do. They can also search by instructors and their qualifications. So if someone wants an instructor to have an additional qualification for their long-term health condition or disability, there's a filter on the website as well, so they can search through that. Parkrun is currently on hold at the moment, but if and when it starts running again, it's a 5K timed run on Saturday morning at 9 a.m. As you can see from the map, it's there's locations all around the county. You don't have to run, people walk, people run with buggies, some locations allow dogs as well. Then if you're not sure, there's also volunteering opportunities, so you can volunteer to see what it's all about before taking part. But again, lots of people do it as a whole family. There's lots of information on the Active Norfolk website. So there's an Active at Home section, which gives lots of ideas on what people can do at home, and lots of links to online videos which people can follow, information sheets, and ideas for different activities for different ages as well. Active Outdoors gives information on how you can get active outdoors, so it gives links to walking routes and other things which you can do outside. Your Health provides information on how physical activity can help manage and prevent long-term health conditions. And then the Disability and Physical Activity provides information for individuals to access and improve physical activity in Norfolk. Also on the Active Norfolk Activity Finder website, there's an activity finder which you can search through location or activity. To say activities are being added check when things kind of re-get added, especially after COVID-19. In regard to resources to talk to service users and patients about physical activity, Moving Medicine is a really good website to look at. It gives step-by-step guides to conversations with patients about physical activity, especially with people with long-term health conditions. So it's broken down into 3 conversations. So there's a 1-minute conversation, which is ideal if you're very short on time. It's just an idea on how to bring up physical activity, which can then lead to further physical activity conversations, maybe to the next appointment. A 5-minute conversation and a more minute conversation for people who have got a lot more time. As part of the Moving Medicine website, there's 13 toolkits, each tailored for different conditions, which includes cancer, COPD, depression, strokes, type 2 diabetes, a general disease prevention one, and musculoskeletal pain. It's just some of the examples. And as part of each guide, there's also a leaflet which gives concise summary of physical activity information for patients on those conditions. I say it's definitely worth having a look on the website just to see what's available. And this is an example of one of the infographics for type 2 diabetes on how physical activity can help. So the idea of these are given to patients and service users. Okay, sorry about that, my computer froze. Also on Moving Medicine, There's some useful tools which might come in handy. There's a workbook which people can use for goal setting. So if they want to increase their physical activity, they can set some short-term and long-term goals. There's the step counting pace up walking program, which is a walking program over a few weeks. And the idea is people increase the number of steps they do each week over time and build up gradually. So people do need to be able to count their steps to kind of take part in the program, because most phones can track steps nowadays, or people will get pedometers, which is really good if someone doesn't want to kind of take up a community session or start running. By just kind of increasing the steps, it's surprising how much fitness they can kind of gain by just increasing the amount of walking they do. And also on moving medicine, there's an activity diary which people can fill in. Say when people fill in activity diaries, they might be absolutely surprised how much activity they already do, and then some people might be kind of shocked on how little they do. So by getting people to write down what they do, it's just easy to kind of track what's being done. Okay, in regards to resources, on our website, we've got lots of useful resources for disability. And then on the Activity Alliance website as well, we've got lots of different resources, engagement fact sheets after the home. So the list kind of goes on. So it's definitely worth having a look at the website just to see kind of what you would find useful. And there's also a reopening activity guide for aimed at leisure centres and community venues looking to reopen gyms and starting the community classes again. And also there is a programme called We Are Undefeatable. The campaign aims to help those with long-term health conditions such as diabetes, cancer, depression, to help build physical activity into their lives. The website gives lots of information on ways to move, how to get started by increasing physical activity, and lots of different case studies. So people are kind of going through the same long-term health conditions on how physical activity has helped them. So it's definitely worth looking on the website. There's also some videos on there as well to take a look at. If anyone wants to take some further training, part of the e-learning for healthcare, there's some physical activity training on there. There's 10 different sessions, and each session takes about 20 to 25 minutes. But you don't need to do all the sessions. You can pick and choose which ones you find useful. So if you use the link on the screen, I'll give further information on how to register. So anyone can sign up. I'm just going to hand you over to Alan Roberts, who's just going to talk briefly about developing skills to deliver sport and physical activity.
Thank you, Amy. As has been mentioned previously, we know that increased fitness and mobility provides greater independence, health, and general well-being. Sport and physical activity should be considered an environment where anyone can gain the opportunity for participation, friendship, enjoyment, and success, as well as develop other skills that will enhance many areas of daily life. The key thing is that anyone can deliver sport and physical activity. All you need is the right tools in your toolbox to be able to. We know that from various insight across the sector that we need a sport and physical activity workforce that better reflects the society we live in and has the skills to engage with the target audience. In essence, we need a someone like me workforce to better engage and increase how much sport and physical activity different areas of the population take part in. Likewise, we need to improve the workforce engagement skills of understanding the individuals with disabilities and long-term conditions to ensure this greater engagement. This is where you come in. It's easier to provide those individuals who already have the skills to engage with the target audience, sport and physical activity delivery skills, than vice versa. This is where we want to support you now and moving forward. On the screen, you'll see there's a whole suite of online face-to-face training out there. At this current time, obviously face-to-face isn't happening, but what better time to access the online content that is out there and start your journey. You'll see on the screen, there's a link to UK Coaching's website. On there, you'll find various tips and online courses to start your delivery. On here, there's condition specific, there's engagement specific, and various tips and different things to consider. Pure Training and Development offer long-term condition specific training, and we're more than happy to put on some online training in partnership with them. If you're interested in delivering sport and physical activity yourself, or would like a conversation about this and how to get started, then please do contact myself on the email address below, aaron.roberts@activenorfolk.org. We'd be more than happy to have a conversation and help you on your journey. For more information on anything you've heard in the presentation, then please contact either Amy on amy.story@activenorfolk.org or Ellen on ellen.vanlent@activenorfolk.org. For anything regarding developing your skills to deliver sport and physical activity, or supporting your service users to do so and develop their skills, then please contact myself on aaron.roberts@activenorfolk.org or call the number on screen 01603 228 938. Thank you very much and enjoy the rest of your day.